2014, I married my best friend. Everything was great, everything was wonderful. Little did I know that within the next 4 months, our life would change dramatically. 4 months later, in 4 months later, at the end of September, my husband's father passed away at the young age of 67. His killer, Alzheimer's disease. What if his death could have been prevented? The Center for Disease Control states that 5 million Americans live with Alzheimer's disease. One study done by 4 researchers and published in the American Academy of Neurology Journal on May 7, 2013, predicts 13.8 million sufferers of this disease by the year 2050, when most of us will be in our 50s and 60s. A new breakthrough in Alzheimer's research could one day make survival a reality. To start, let's learn a little bit about Alzheimer's disease before discovering the breakthrough. The term Alzheimer's originates from the doctor who originally presented the case. Her name was Dr. Alzheimer, and she presented in a medical meeting the case of a 51-year-old female who had an unusual condition in her brain. The Alzheimer's Foundation of America defines Alzheimer's as a progressive degenerative disorder that attacks the neurons in the human brain. This affects memory at the initial onset, but it becomes a problem with behavior and activities of daily living as time goes on. They state that it is not a normal part of the aging process, which many Americans believe is the case. However, it is the most common cause of decreased intellectual functioning in adults over the age of 65. Alzheimer's creates 2 types of abnormal lesions in the human brain. One that is referred to as plaques, and the other that is referred to as tangles. Plaques are basically chunks, sticky chunks of protein that are inside the neuron cells. Tangles are kind of like wires that are just tangled together, making the cells ultimately die. The Alzheimer's Association states that Alzheimer's is the 6th leading cause of death among adults, most living an average of only 8 years after their symptoms become noticeable to the people around them. That is not a very good prognosis, and there is no cure at this time. This new breakthrough in research could change that, making life better for ourselves and for our parents. A Duke University study published in the April 2015 Journal of Neuroscience points to a potential new cause of Alzheimer's disease. The study is led by Dr. Carol Coltman, who is a professor at the Duke University School of Medicine. The study is based on mice that they have genetically modified by changing a handful of genes so that their immune systems more accurately mimic the immune systems of human beings. In the field of Alzheimer's research, these mice are unique because they have the similarities in their brain. They have been recognized to have plaques, tangles, behavioral changes, and that they experience a gradual onset of the symptoms. Because of the gradual onset of symptoms, the scientists were able to observe the mice and the changes in the brain from the beginning of the onset to the severe cases. They were able to use a drug that is currently used in human trials for treating cancer. They used this drug in the mice before the onset of the symptoms, and these mice experienced less plaque in their brain, less tangles in their brain, and they performed better on a memory test. The scientists examined their immune systems and saw that most aspects of their immune system remained unchanged except for one thing. They noticed micralgia began to divide and change in the very beginning stages of the disease. Micralgia are known to be first responders in the human immune system. If we're able to block this drug, if we're able to use a drug to block the micralgia, which ultimately creates the plaque in the brain, we may be able to prevent Alzheimer's disease. The researchers of this study are currently doing a study to investigate whether these drugs help after the onset. With continued research in the field by devoted researchers, Alzheimer's survival may become a reality. It can't bring Ron Sr. back, but it may save ourselves, our parents, and our posterity.